Well, good afternoon, folks. So happy to be here with you. What I was telling Allison is, part of the real success of an event like this is all the new connections that you make. So, we were standing in line for lunch. I think I made the best connections in line for lunch. So I really do appreciate being here. So I'm Gary Pisano. I'm the president and CEO of Leading Age PA. Leading Age PA is a trade association. We represent over 420 aging services providers who represent the entire ecosystem of aging services. I'd like to say, wherever older Pennsylvanians decide to live or access their care, we represent those providers. We are on the Hill in Harrisburg advocating for funding, for health policy reform, for really transforming the way healthcare is paid for. And in regard to how healthcare is delivered, we have a very robust education curriculum, helping licensed professionals maintain their certifications, but also building bench strength in our member communities. And New Cortland is one of our really active, forward-thinking, engaged members, and we're happy to be here. Another piece of what we do at Leading Age PA is to address the business of aging services, to avail our members to business solutions that we vetted, partnerships that we made. So on our panel here, we have folks who represent different areas where you could innovate. Education, whether it's a service, a product, and we're going to explore a little bit of that. What I'd like to do is, we're going to talk about me the rest of the day, right? But seriously, because I'm a boomer, and now I have a vested interest. So the comments I make, they come from a lens of being a speech-language pathologist, a clinical operator for 40 years of my career, now in this area of advocacy, but also have responsibility to care for my mother-in-law, Marge, who's 90. And if you say, hello, Marge, she says, I'm not leaving my house, right? And my father, Nicholas, who's 88, who's thriving in a retirement community. I bring that up because they're on my mind constantly, but also because they have choices. And that really is the goal for older people. They should have choices, okay? What I'd like to do is, I'd like to give you some context for the people that we're going to talk about. And Ashish started us off talking about the silver tsunami. It's a real thing. We're here. A few things about this population. Well, first of all, these numbers. This comes from the U.S. Census Bureau. We're expected to see more people age 65 and older than people under 16 by 2034, okay? You must pay attention to us. We are many. Okay, and the over 85 population is expected to double in the next 20 years. And let me tell you about this population, right? It's not like other generations. So there was a study done, surveyed about 7,000 older adults. 22% no children. 37% have no grandchildren. Middle and high-income boomers less likely to live with or near their children, more likely to be divorced than prior generations, right? You're talking about, there would be traditionally your caregivers. We're going to have to figure out something. Baby boomers have greater number of chronic health conditions than previous generations. Why is that? Because it used to be that those conditions would kill us. Now they don't kill us. We learn how to manage them. But they exist. And if you're going to live a healthy life, you're going to have to learn how to manage your chronic conditions. 48 states are projected to have double-digit percentage increases in the number of those folks 65 and over with Alzheimer's dementia. And, it was projecting 2025. Well, we're here, all right? By 2060, there's expected to be 2.5 working age adults for every older person eligible for Social Security. That's a heavy burden. There's another phenomenon going on here, and this comes from a study done by Deloitte, and that is that we see lifespan increasing. On average, we see folks living to be 78 and 79 years old. And we know we don't even celebrate on the news anymore when somebody turns 100, right? Because there's just so many of them. He's still doing that? Go. What's happening, though, is it's not necessarily that we're extending just lifespan. We're extending health span. And that really is defined the period of your life where you're still thriving and you're enjoying life. That's what's happening. So I raise this because this panel is really going to help us dig in a little bit too. So what should we be doing for them? What should providers be looking to do? What should developers be looking to do? And this is what Deloitte put out, that we'll need to be treating chronic disease and helping people manage their chronic disease. And we'll need to be focusing on loneliness, isolation, depression, and dementia, right? There's going to be a focus in those areas because there needs to be. We're seeing more people working well into their 70s, and for many people, it's a choice. I can't see you right now, but we were having a good conversation about how we're not retiring anytime soon, right? You can't make us. There's also a shift in care settings, reduction in skilled nursing facility capacity, and greater movement into the home and community setting, right? Maintaining choice in aging. So we ask ourselves, how can companies innovate and develop products and services for the future of healthcare and aging? And what really this Deloitte study comes to is it's going to be about technology to support every need and perform many actions on behalf of consumers. So really, that is the context that we're going to be talking to, and I really want to give these folks a chance to talk. So maybe, Jack, you'll start us off. You know, by way of introduction, maybe you could tell us, what does EmpathyTech mean to you, and how does it show up in your work?
Thank you. Thank you, Gary. I knew I'd picked the wrong seat. I guess I got to start. We were playing musical chairs. First of all, it's great to meet everyone. I'm Jack Stoddard. I've built and scaled a number of tech-enabled services companies focused on improving the healthcare experience for people. Today, I'm the founder and CEO of a company called Patina. As the name implies, patina is that beauty that emerges through the passage of time. It's your favorite, baseball glove or jeans, or it's that beauty that's on the Statue of Liberty. So we kind of took that name because it captures the poetry of what we do. You asked about sort of empathy in tech. We are doing something bold, which is building an entire new care model for people 65 and older. It's a result of me watching my own parents. I know many of us in this room have kind of come at this from firsthand experience as a caregiver, watching those that you love not getting the care, the dignity, the respect that they deserve. Gary walked you through, and we've heard a lot of data about this rising population, but at the end of it, those are real people, and they are living longer. They have so much to give in terms of wisdom and insight, and we need to honor and respect them. And unfortunately, they're bumping into a healthcare system and a social support system that is not designed for their age or their needs. And so I looked at that problem and said, well, why don't we try to go build a care model that is designed exclusively for people 65 and older and does what healthcare should do for all of us, but especially for older adults. And so I set out to build a company that is really redefining the healthcare and aging experience. We do end-to-end primary care for older adults that is whole person, medical, behavioral, social care. We do it the way it should be done, which is we put this person in the center, we get to know them, we coordinate care across all their specialists, we do the legwork, we address their social needs, and we do it in the setting of care, which is where most people spend their time, which is in the home. So we do it through a virtual and in-home, eyes-on, hands-on care model, which allows us to go wherever anybody is. So we're building that to support that. The only way you can do that is you need a business model that supports it. So we built it on a value-based care chassis, and you need to be able to scale it across the country. We're now in multiple markets in multiple states, and to do that, we had to build a big tech platform. So it's a lot of tech, a lot of analytics, but our view is that's to support individual relationships with caregivers and social workers to really take care of people and know them, know their needs, put the pieces together and get them the care that they deserve. So it's an end-to-end solution, and I'm excited to be part of this panel. So thanks, Gary.
Great, thanks, Jack. Kelly, you want to go next?
Yeah,
we can just go right down the line.
You got it. Kelly Johnston with a company called Quarvis Health. My background is really managed care. I grew up at U.S. Healthcare and ultimately Aetna. We left there, hey-o, and Aetna in the house. And we left there and started a company called Health Advocate. Health Advocate grew from an idea to about 40 million members. We ultimately exited that and started a company now. We initially started a company called Hands Free Health, which is now part of Quarvis Health. We decided to try to revolutionize the PERS market a bit. So we built a voice-enabled platform that is delivered via a speaker, a watch, and a pendant. It allows for medication reminders. So there's an app where loved ones, people in the care circle can set up medication reminders, appointment reminders that'll fire to those devices to help keep mom and dad on track. We then notify them if they've ignored it or skipped it so that they can sort of like reach out to that loved one and, hey, mom, looks like maybe you need to take something. And then started to really look at isolation and loneliness. We embedded ChatGPT to our platform. We know isolation and loneliness is like the new smoking now. It really is horrific for folks that are just alone and don't have support. So we've tried to really make a platform that is engaging. And then, God forbid you have an emergency, you still have that PERS button, you still have the ability using your voice or a button to get the help that you need. That's where we are.
Thanks, Kelly.
Yes, thank you, Gary. My name is Andersen. I'm the CEO of SensCom, which have the solution DignaCare, which is an incontinence sensor. I started off my career as a certified nurse, and even though I've been working in the medical industry for close to 25 years now, I say as the state representative, once a nurse, always a nurse. Yep. And one of the most significant challenges that I observed in healthcare is that despite the best intentions and the tremendous workload, caregivers are often stretched thin and some essential needs are missed. And that's why initially drew me to DignaCare. Here we're using technology to improve quality of life for people who struggle with incontinence but are often unable to communicate their need or have reduced mobility. Our founder, Vidar Rinde Halvorsen, he initially started with an idea to create an incontinence sensor initially for children. But when his mother suffered a stroke, his focus shifted and she became dependent on care. And although she was mentally clear, she needed help with toileting and changing. And too often, when he visited, he would find her in wet pads, experience leakage to the bed clothing, and she felt deep shame about this and asked Vidar to make sure that Sensor ID would become a reality to help others avoid her same situation. And I don't know if all of you are aware of that. Some of you probably are, but incontinence is one of the biggest challenges within elderly care and definitely one of the most unaddressed challenges. They are bringing not only shame and bad life quality, but also complications like sore skin, urinary tract infections, and also sleep disturbances. And of course, it's adding on the workload for both family caregivers and also for the caregivers, professional caregivers, because you need to change the bed clothing more often. So that's why it's important. And that's why I'm passionate about to have sustainable elderly care enabled by technology. Often technology aims to improve the individual situation, but also brings what I like to call a triple win effect. It enhances the daily life of caregivers by reducing their workload, improves the individual's quality of life, and creates resource optimization, leading to economic benefits. Technology with empathy is about creating solutions that respect and understand the core needs of both individuals and those who support care. Thank you.
Thank you. Good story. I like that.
Hi, everybody. My name is Ann Olin. probably like most of you in the room, I have both a personal and professional connection to EmpathyTech. On the personal front, currently, I have a brother-in-law, now 69, who has been living with Parkinson's disease for about 10 years. His decline has been slow and steady, but he's at a bad place right now, both cognitively and physically. I'm very close with my sister, his wife, who's his primary caregiver, and I see all the time firsthand what a tremendous difference EmpathyTech can make in their lives, and I see all the work that still is needed to make their lives better than it currently is. Amazing support, amazing technology, and particularly so when you find the devices or the tools that are created with empathy in mind. On the professional side, I'm a little bit, I think, a fish out of water here in that I don't work for a company that is focused on EmpathyTech or tech as its main product. I work at TIAA, Teachers Insurance and Annuity Association, which is a financial services company that primarily provides pensions and other financial products to colleges and universities, other nonprofits, and the people that work for those organizations. In my current role, I work at the TIAA Institute, which is a think tank within TIAA. We do research, we engage in partnerships, we host programs like this. Right now, we're prioritizing a lot of our work on longevity fitness and other aspects of our aging society. As we heard here, we're marching toward 100-year lives as a retirement company. That's important to us, but we care deeply about it too. TIAA, as I said, is a mission-driven company, started in 1918 for the sole purpose of supporting educators who weren't being positioned to retire with dignity. So empathy, I like to think, is in TIAA's DNA. I've worked there for 40 years, in part because I think I'm a very empathetic person, and I love that my colleagues are empathetic people. We have our formally articulated values at TIAA, things like be client obsessed or delight our clients, and we really live by those words. Recently, as we've been pursuing this work around caregiving, longevity fitness, I've had the privilege of engaging with colleagues on TIAA's accessibility and inclusion team. I hadn't really known about it, but I've gotten to know about it. That team is in place to ensure that all those served by TIAA, thousands and thousands of people, can access all the financial information, resources, forms, the forms you might need to start drawing down your pension. Make sure that they're accessible to people with physical and cognitive disabilities. We do a lot to make sure we deliver our products and services in ways that connect with the Hispanic community, with women, maybe differently than men, with the Black community, maybe in ways that are appropriately different. But now, more and more, we are really focusing on making ourselves more accessible to those with physical and cognitive limitations, and I think that's just really terrific. And I'll tell you more about that as we go along, but now over to you.
Yeah, Dr. Demiris.
Thank you. So I'm George Demiris. I'm with the University of Pennsylvania School of Nursing, and I do research in the area of aging and technology, and more specifically, trying to design, implement, and evaluate technologies that can help older adults and their families age in place. And I actually started back in the 90s when I was doing my dissertation work. My advisor at the time at the University of Minnesota had a project to look at telehome care, which was basically home-based telehealth, which at the time was considered pretty innovative because it allowed people to stay at home and capture their vital signs and transmit that data, and even have video visits with a nurse, which back then was dial-up and really bad quality video, but at least it was a way for people to stay connected. And what we realized early on was that both older adults and families were asked to use technologies that sometimes had been designed without their feedback and were not necessarily appropriate for them to use. Furthermore, it was the family caregivers that had to take on the burden of learning to operate new hardware or software. So even though it was supposed to be a solution that would make things easier and increase access, it was actually ultimately the family caregivers who had to change their workflow and add on new responsibilities. I remember we're using a portable spirometer at the time to measure lung capacity. It was pretty complicated to learn how to exhale air when the circles would stop flashing. And it was the family members that had to do this while the patient had the tube and the mouthpiece to blow the air. They were also the ones asked to enter data and fill out diaries with information about vital signs and other symptoms. So it became clear to me that even though the family members and in general the informal or unpaid caregivers play such a crucial role in the healthcare of older adults at home and in different community settings, they're often not really at the table when decisions are being made. And more importantly, for the technology piece, they're not at the table when new technologies are being designed. And I think now with the proliferation of new technologies, especially with artificial intelligence, we do have a lot of new powerful tools that can allow us to do many more things at home that we couldn't have imagined before. But empathy, I think, is key in driving the design of these solutions if we want them to be ultimately used and be effective for the end users who are the older adults and the family members. And as many of you have pointed out, oftentimes family caregivers are not only executing that one role. Sometimes they're caregivers of more than one people. Sometimes they're caregivers of a parent and a sibling and maybe a son or a daughter. They're also working in some cases. And so all these issues that oftentimes we try to measure as caregiver burden have been found to affect their own health. As a matter of fact, there's all these pretty, I think, powerful statistics that show that family caregivers of loved ones at the end of life tend to have increased mortality and morbidity themselves within 2 years after that experience. So clearly we need to find ways to make these technologies work by centering the caregiver's voice in that design process. And ultimately, I think when we think about how to deploy these technologies in homes and communities, we have to also recognize that technology is meant to bridge the gap and increase access, but sometimes it could exacerbate existing inequities. And again, I think that's where empathy can help us have a more inclusive design so that those technologies can benefit the greatest number of people.
The work you're doing is inspiring. I mean, you really do define empathy in this. As Ashish brought up, feeling like we're a little behind. You know, it's like 10 years, right? Where we wish that we were much further ahead. We've got workforce issues. And I know, Ann, you could speak to what we could do on the education end of, you know, helping to get the people resources we need. The work is caring for a growing population. It's growing every day. So how do we speed this up? How do we get it going? If you could speak to some of the barriers that we're up against and add to that, how are you overcoming these barriers? And did you want to start with the education piece?
Sure. So I think we keep running up against a significant challenge in getting information about the innovative products and solutions, as you were saying, to the people that are giving the care or needing the care. You know, we have these wonderful new advances, but we need to get them to the people who need them in ways that they are comfortable using. So TIAA, our primary market is higher education, and we do see colleges and universities as being one significant channel for helping educate and provide support and build bridges across silos. We just released a paper with the Gerontological Society of America called something like Learners for Life, Higher Education in an Era of Longevity. And it really is exploring the many new opportunities that are arising because colleges and universities are beginning to serve non-traditional older students in new ways. And as they do so, we can tap into that new, more inclusive, age-friendly sector, higher ed sector, to teach more people about the innovations, to host joint convenings that bring investors together with the experts who can share information about the new products and services. So I would just say, don't underlook colleges and universities as partners to advance the good work that we're all trying to do. They're ready, willing, and able. I think they just don't know how to find everyone that could benefit from their ability to get information out.
Yeah, very good point. Has to do with communication. Kelly, did you want to talk about some of the, as you're doing this work, some of the barriers you're up against, and then, how do you overcome them, or how are you thinking about overcoming them if they're still really there?
Yeah, there are a lot of barriers. We heard in the earlier panel about, money and funding, and it's a very, very tough time to raise money. And so, that is a constant challenge when you're doing startups. We've been around a while, and we've been working at it a while, and we've had to be agile. We talked about being iterative, learning as you go, making changes. I think we've made great devices that are easy to use. I think we over-engineered our app, and we've learned that, and we're sort of trying to, bring it down, make it simpler, make sure that these caregivers that are in the family find it simple and easy to use. So. I don't think it's, straightforward. I think we're in an industry that's been around a long time. Help, I've fallen and I can't get up. A terribly stigmatized industry. Most of the seniors don't want to wear buttons and watches and things like that, but their adult children want them to, and they want them to feel safe. So, we have to overcome stigma. And I think it's getting better. I think marketing is getting better. But it's a very competitive market. There was a company, Silver Tree, came out about a year ago. Martha Stewart was their spokesperson, and they shuttered, like in a year. It was a very beautiful bracelet, but it was lacking two-way communication. It was lacking some very basic things that you just have to have. So, you can have a lot of money behind you and still fail. You can have very little money behind you and just kind of keep chugging along, which is what we do.
Good for you. Yeah. Ellen, what about the barriers that that you've discovered, in trying to bring a solution forth?
I think we learned that you need to see beyond the product. You need to integrate into existing workflows and organizational buy-in. You can't just come along with a product and an app. You need to integrate into existing systems like patient alert systems or electronic patient records, for instance. Now we're discussing with Pleatly how we can integrate into PleatlyCare. That's a collaboration that came out of EmpathyTech in Oslo earlier this year. But I think what we experience in Norway, at least, probably much better over here, but is the resistance of change. The healthcare sector is very loyal to how you've done things beforehand. When things are worked into the routines, it's very hard to change it. So what we see is that to come around this, we have worked a lot with implementation to get the leadership buy-in. Clear communication from the leadership is essential, and then we work with a non-profit organization in Norway, very similar to New Cortland, both in size and in how they work. And what we see to succeed there is that we have actually gotten a very good relationship with the top management, and that they are following the implementation all through the organization, so that the organization understand why are we doing this, how should we use this product, what is the benefits, what's the goal of using it, and that, at least for us, has been a success factor. Thank you.
I like that. I do want to hear from Dr. Demiris and Jack. I'll interject something here. So I'm a caregiver by profession. we're talking about empathy, and we're being very polite about the challenges and how we overcome them. Part of my job is to go to the Hill, right, and tell a story about why we need funding and why we need reform to health policy and why we need legislation that makes sense and doesn't get in the way of caring for people, but enables us to do a good job of caring for people. Use all the science we have and apply it to caring for older people. So I want you to get a little dark on me now, okay? I want to hear, what can I go to the Hill with and ask for? What do we need to really get things moving exponentially here?
So from a research perspective, since I'm also Associate Dean for Research in my school, I would say more funding. But I think we need more partnerships between academia and industry in terms of creating solutions that are thoroughly designed and evaluated. One of the problems is, on the one hand, in academic research, things take too long, perhaps so much longer than the technology that develops very rapidly. So a researcher that wants to test a system has to conceptualize the study, apply for funding, hopefully get the funding to execute the study. So this could take multiple years. On the other hand, industry moves fast, but sometimes may not necessarily engage the stakeholders in a very thorough design and evaluation process. Having these partnerships where the expertise from both sides come together, I think will lead to more evidence. Because back to your question, I think what we need is solid evidence in terms of what works and what doesn't work. When we think about reimbursement for different technologies, we need to have evidence as to how it impacts either processes or outcomes of care. And I think sometimes that is a challenge with new technologies. There is an excitement for a new technology, but it often is not deployed thoroughly or extensively, so we don't have enough data, so it's hard to know if we were to reimburse for this, would we actually be saving money or improving healthcare outcomes? We had done several years ago a study looking at different fall detection technologies, and we were surprised to find out that many of these technologies or companies had done all their testing with either college volunteers or college kids or stunt actors who are trained to simulate falls. So as you can imagine, these types of data are not really the solid evidence you would need to say, yes, this system is reliable and valid. So as we think about what we need to advance this field, I think we need to create the right conditions to expedite the generation of new evidence. Because as you said, this needs to be done, and it has an urgency to it, and we need to do this right. So I think having the right partnerships in place would potentially accelerate that.
Yeah, I think you're right. And champions we have, like Representative Kane, who was here earlier this morning. I mean, we really are in a good place in Pennsylvania, where we have any number of champions who want to take up the cause, and who we're having legislative hearings on this. Governor Shapiro has really been very responsive to us, and I feel like our time has come, and if we could come with the right information. And Jack, I think you tapped into it with how you're working. I mean, with the payers.
Yeah. To your point on the governor, the Secretary of Aging came and visited us recently and wanted to learn more about Patina and the way that we're scaling age-friendly care. What I would, if I were going to try to scare people or take them to the Hill, is just read them all the stats that you opened this with about the aging population. But the reality is, as a country, I think between climate change and aging population, these are the big problems, and nobody's really looking at them. The wonderful news is people are living longer. The challenge is we are not prepared as a country. We are not prepared to take care of them. We are all feeling that burden. You're kind of getting the creakiness right now because caregivers are kind of stepping into that void. But the healthcare system, the social support systems in this country are not equipped to deal with the rising demand that we have putting on it. On top of that, you have a decreasing supply of primary care, right? So and you have an affordability problem. So if you go to the Big Hill in Washington, Medicare trust fund is going to go broke. And so you've got an affordability problem, you've got a supply challenge in terms of primary care, and you have a demand that's increasing. So we as a country need to kind of come and find different ways to do this. On top of that, the problems are much more acute in rural parts of the Commonwealth. That's what the Secretary of Aging was looking at. And we've designed our solution to go where the people are versus having people go to the clinics. If you're going to be in a clinic-based model, which is not designed for the benefit of the person, it was designed because of the business economics, right? It basically said the doctor's time is more valuable in a fee-for-service reimbursement. So have sick people come to you. My great-grandfather used to take horse and buggy to people's homes and provide primary care. That's what we're using tech to do, is to go back into the home. We can be in somebody's home in seconds on a piece of glass, and when eyes on hands-on care are necessary, we get our clinician into the home. But we are able to use tech in a completely different way, in many ways go back in time. But we have to act with more urgency. We have to get these new models, we have to use tech. And for all of us who are designing tech solutions, I would also say, let's not get so enamored by our tech. It is a solution and a problem that we have to solve, and that's what we need to talk about. The tech should disappear. The tech should go away. It should be the enabler of this to scale. And if you can do those things, you're going to start to generate real value. And at a time when the country's going to say, like, hey, we need more solutions and we need them to be scalable. And so we're going to have to do things differently.
Well, I think that we've got to take full advantage of having you experts who are living this on the panel. Folks want to hear about how is it that you take this service that you've got, incredible service. It really, it meets people where they are, and you are scaling it, but you've got the attention of payers, you've got the attention of insurance companies. How do you go about doing that?
That's hard. I mean, especially as a startup. And they're back to, I think somebody said, like, there's all the incumbents and they do things in a certain way. And it's really one of the toughest things for an entrepreneur is to get that momentum. And so what I would do is, I recommend is, find somebody who believes in your view of the future. And we were lucky with Independence Blue Cross here in Philadelphia that they, I had met with them and they heard the vision and they said, if you build that, we'll help you get this to our members. And then you start, and then there is sort of a herd mentality, which is if you can then go from Independence Blue Cross and go to Aetna and go to Humana and go to United and go to Cigna, and then you can start to get the flywheel moving. But as Ashish knows, I mean, 10 years you've been at it. I've been at it 4, and it's like, your shoulder. The reason it feels like overnight is we were laughing because you haven't slept in 10 years. You've been awake. But it really, you have to get the flywheel going as an entrepreneur, and then there's a moment where it actually starts to go, and then it begins to spin. And, I think that you have to generate data and results. And that's the thing, is if you can get someone to give you a shot and get some proof points under your belt, then you go from selling vision to selling outcomes. And then those payers, and the good news, like where I sit, is the number one problem. Go look at United stock and Humana stock and Aetna stock and everybody's. They're all down because Medicare Advantage is underwater. And the reason it's underwater is they have more people who are bumping into a healthcare system that's not age-friendly. And so people get bounced around and it costs more. And so we're fortunate to be now having built for 4 years a solution that can actually get people a better outcome, better experience, and lower cost, because you just do the right thing for each person and get them the care that they need in the right place. That actually is less expensive. So that's how the flywheel gets going. But, it takes perseverance, it takes a great team, and it takes capital to get to go do it. And any one of those disappears, and, these ideas and innovation can go up in a puff of smoke.
Yeah, it is a hard road. And, what really has been, I've been reminded of being here today is we're talking a lot about collaboration and how you don't do this alone. So, you take a great provider like New Cortland and other providers like New Cortland to engage in the process, to really get to solving the real problems, have those solutions be integrated, right? Just like we're talking about having integrated solutions, and then a plug for the providers. I mean, the care you're providing is making a difference in people's lives, right? The socialization you provide, the coordination of care, but who is left out of the equation when the insurance company gets paid? We are, and we've got to do something about that. Some glimmers. We are absolutely, we're here today. We're talking about innovations. We were able to touch and see innovations. What are the glimmers of hope that you see out there that we're on the right track? Ann?
I'll start. Well, I think where you just started, the breaking down of some silos, I think, is a very positive step forward. Again, from my perch at TIAA, we talk about health and wealth being two sides of the same coin, and they are. Your financial circumstances to and through retirement are going to be dramatically impacted by your own health or the health of the people you're caring for. Your health is going to be impacted by your finances if they're going not well. So it just seems like it's a no-brainer that there shouldn't be these walls between the healthcare sector, the financial services sector, and maybe there are partnerships that we haven't tapped yet, not just in terms of funding for new innovative solutions, but just even in partnering to help the persons holistically and addressing for the caregiver or for the individuals needing the care, the physical health aspects, but also the loneliness aspects, the financial aspects, and maybe working together to build some more holistic opportunities to serve.
I like that, Ann. So we're running up on time. So what was a question to the panel is going to turn into lightning round, okay? So glimmer of hope. If we could go down the line, glimmer of hope.
I would say we have now more recognition of the caregiver's role with federal initiatives, with demonstration projects. So I think it is hopeful that caregivers are being invited to be at the table as we design new solutions.
Great. Thank you, Dr. Demiris. Ellen?
I think it's positive. There's more cross-sector partnerships, and that's necessary in order to overcome this challenge with the increasing elderly population. And that, I think, will build on a good caregiving situation also. Mm-hmm.
Thank you.
I would say AI. To some people, that's like a naughty word, but it really is helping us deploy technology and develop so much quicker, and kind of learn things a little bit faster than we had been before. So I'm not all about replacing human beings. I don't think that's what it's about, but using AI to assist you to become more efficient is really helping us a lot right now.
Great.
I think the glimmer of hope for me as a seasoned entrepreneur is just watching the young talent entering the space. The idea of working on engineering solutions to improve people's lives is so much more meaningful to the young engineers and product designers today than putting another widget into an Amazon shopping basket. And I just am blown away by the vision and the energy and the talent that's flowing into the space. And that gives me a big glimmer of hope.
I like that. So I appreciate the time. And anyone who knows me knows that I'm actually famous for giving unsolicited advice. So here's my advice. I got to hear CEO of New Cortland, Joe Duffy, say this, and I went and then I read it. And it's about what the vision and the mission is. And it really is to provide equity in health and in housing and in social services. And then when you read the path as to how they're going to get there, actually called out is a focus on innovation. So I would challenge all of us, as you're writing your strategic plan and your personal strategic plan, let's all commit to innovation, because that's really how we're going to move the needle. But thank you, everyone.